Hi, I'm Marissa Filial. I am the care coordinator and I'm from UMKC School of Health Science.
Hi, my name is Kara Moore and I am the nurse on the care team and I attend St. Luke's College of Health Science at Rockhurst.
Hi, I'm Jonah Heitman and I play the dentist and physician. I'm a student at the UMKC School of Dentistry.
Hi, I'm Amanda Broughton. I'm an occupational therapist and also representing the physical therapist. I'm a student at Rockhurst University Occupational Therapy Department.
I am Megan Porter. I am the speech language pathologist and I'm a student at Rockhurst University.
And we're Mr. Williams'
Dream Team.
All right.
Okay, welcome team. Today we have Henry Williams, a 69-year-old male who was admitted to Poplar Bluff Regional Medical with acute exacerbation of COPD. He has a history of hypertension, COPD, asthma, and acute bronchitis. Mr. Williams will be discharging back home with his wife Eartha, and we have set up Sunrise Home Health to follow him post-discharge. Dr. Jonah, do you have any recommendations?
Well, team, it looks like Mr. Williams' primary concerns are from the complications with his COPD. So I think that if we work together, we can help him breathe better, and that'll really improve his quality of life. So I think that we should start with the same medications that we had at the hospital discharge, and then that will manage his hypertension, his asthma, and his other conditions. I also saw on his chart that he has some dental concerns, and I know a guy in Poplar Bluff that's really good at dentistry, so we'll make a special referral to him. Nurse Kyra, do you have any recommendations?
Yeah, absolutely. I plan to talk to the nurse manager at Sunrise Home Health Care so that she can disclose his medication record and his chart so the transition can be as seamless as possible. I think that continuing the plan of care that we had at the rehab and then continuing his med list and planning for a follow-up sounds like a great start for Mr. Williams.
And the physical therapist was not able to make it today, but I met with him earlier, and I have notes from him as well. So we both pretty much agree on his plan of care for occupational therapy and physical therapy moving forward. We want him to, we recommend home health, OT, and PT to continue his work on his strength, his balance, endurance, activity tolerance, and energy conservation techniques.
I'm recommending compensatory strategies for speech concerns and managing his unsafe swallow with dietary changes. I'm also going to refer him to a nutritionist to ensure that his nutritional needs are met with those diet changes. SpeechPath will visit him at home once a week to reinforce those speaking strategies and do ongoing assessment of his swallow.
Okay guys, I think all these recommendations sound great for Mr. Williams. Let's meet back here in about a week to discuss some progress, but for now let's get Mr. Williams home.
Sounds good.
All right.
Hi, Mr. Williams. My name is Marissa, and I'm going to be your care coordinator here at Poplar Bluff Regional Medical. I understand you've made some great improvements here at our rehab facility, and we want to continue that progress when you leave here. And also, Betty, I understand you have some concerns post-discharge. We will have Sunrise Home Health set up with all of the services for him to live as independently and safely as possible. Actually, your physician's here. I'm going to give you a warm handoff to Dr. Jonah, okay?
All right. Hello, Mr. Williams. I'm Dr. Jonah. It's nice to meet you. Let me take a look here for a second. Okay. Well, Mr. Williams, it's great to meet you. I'm sorry that you had to go to the hospital. I hope that you're feeling better. But I am glad that you are feeling better and here with me today. We have just created a team of healthcare professionals that are going to look after you. We have specialists that have degrees in each and every one of your problems that we're going to look into, and we're going to give you the best care that we possibly can. Now, upon looking at your hospital discharge, I would like to continue the plan to keep you on the medications that you're prescribed on discharge. Our goal is for you to keep your blood pressure controlled and make sure you're still able to breathe properly. In order to do so, please be sure to take your medications. I am also going to refer you to a respiratory therapist friend of mine. I think that if we work together on your breathing, then you can hopefully feel more comfortable now and stay at your home again. I would also recommend stopping smoking, but I know a dentist that can help with that and can take a look at that sore throat and sore spot you have in your gums. All right, I'm going to introduce you to Nurse Kyra, and then we'll be on your way.
Hello, Mr. Williams. It was an absolute pleasure taking care of you. I'm just here to give you a couple reminders as you transition to Sunrise Home Health Care. A few things that we have room for improvement for your depression. We're going to review, remember those mindful practice exercises. Remember to meditate or pray, whatever your preference is, and then to actually do physical exercise within your activity and tolerance. As far as patient education is concerned, we just suggest that you start a smoking cessation program. The smoking has to do with your COPD, so we just want to decrease the pressure that we're putting in your lungs, the stress that we're putting in your lungs, and so that we can get you as healthy as possible, as fast as possible. Along with that, we're going to start a healthy diet, and then exercise, of course, within your activity and tolerance. As far as home health, I've made all the nurses and the nurse manager aware at Sunrise Home Health about who you are as a person, as well as your medical history. In addition to that, we're going to continue the plan of care that we had here, and then we're going to facilitate a follow-up with your PCP. And if you're overwhelmed with all of this information, no worries. We have created a discharge packet that will explain this and more. It was a pleasure taking care of you, and take care, okay?
Well, I didn't mean to interrupt earlier. Hello, I'm Dr. Heitman. Let me take a look. Hello, Mr. Williams. Okay. Well, Mr. Williams, I've heard that you were having some trouble with your gums being sore. Your dentures are feeling a little bit loose, and the burning feeling in your mouth might be because of that. After examining your teeth, your mouth, and your extraoral areas, I think that you and I can create a plan to help your teeth and your mouth feel better. To start, I noticed that you had a basal cell nodule removed from the upper side of your forehead. For now, it looks like that's scar tissue and it's healing, but I'd like to monitor it in a few months. I see that your dentures are indeed loose and the tissue that your dentures rest on are inflamed. I think that we can make a new upper full denture for you and a lower new partial denture. In the meantime, I'd like to do what's called the soft tissue reline on your current dentures. This process is very affordable, and it will allow your gum tissues to heal while you continue to wear your current dentures until your new ones are made. Regarding your front lower teeth, I had to see some plaque, and I can't determine the status of those teeth without a deep cleaning. Next appointment, we can schedule you for a deep cleaning, and that will reduce the plaque and the inflammation around those teeth. Feel free to bring Eartha at the same time, and we'd be happy to see her for an initial exam. With your medical conditions, I'd like to reach out to your physician, and in fact, I already have. He recommended short morning appointments, stress reduction protocol, low flow oxygen, and that you continue to take your hypertension medication. If you do those things, we'll be able to do a deep cleaning and get your mouth treated just right. Feel free to ask any questions, and it was nice to meet you.
Hi, Mr. Williams. I'm your OT. You know me. We've been working on your activities of daily living. I'm here to speak for both myself and the physical therapist. He was not able to make it today, but we have met previously and we agree on your plan of care moving forward as you return home. We know that you have done a really good job progressing while you've been in rehab, and you have achieved the big requirement, which was being modified independent in all of your mobility, which means that you can do everything with the aid of grab bars and a walker, but you don't need other people to help you in terms of transferring. So with that, we had a home assessment done while you were here in rehab and have several recommendations in terms of equipment and adaptations that need to happen to your home. You know, several grab bars that need to be installed in your bathroom and such. Until that occurs, we recommend that you shower with the help of a home health aide so they can be there to help just in case. And then we also recommend that you continue OT and PT with home health to continue working on building your strength and balance, your endurance, activity tolerance, and working on energy conservation techniques so that you can continue to help take care of your wife and stay healthy and continue living your life as you would otherwise.
Hello, Mr. Williams. My name is Miss Porter, and I'm going to talk to you about our plans for your speech and swallowing concerns. I know that the exacerbation of your COPD has made speaking difficult for you, and I know that the accompanying fatigue has limited your ability to eat your meals as you used to. I want to continue with the strategies that you've been working on here because I think they're really great things that you can do on your own at home. I recommend sticking with the strategy of speaking only 4 syllables or less on one breath. Keeping this in mind will help make sure that you have the adequate breath you need to support your voice. I know this can take some practice to get used to, which is why I'm recommending that we hang reminders in your home until using this strategy feels more comfortable. And we will help find places around the house where these reminders make sense, like in the living room, if that's where you often chat with your wife. I also think it would be helpful to share this strategy with the other members of your care team so that they can help remind you to use this strategy when they are in your home visiting with you. Additionally, your doctor recommended a soft diet while you were here inpatient, and I'm recommending that we continue that at home. The home health speech therapist who comes to visit you will continually reevaluate the safety of your swallow and will help you adjust as needed. A soft diet will also help you take in more food while exerting less energy, and I know fatigue has limited your food intake in the past. Your visiting speech therapist will help you adjust your fluctuating fatigue levels.
Okay, Mr. Williams, if you have any questions, feel free to reach out to any of us. Go ahead and press your call light. But if you and Betty are okay with that, then we have transportation set up for you at 2 o'clock and you'll be heading home soon, okay? Thank you.
All right, team. Good to see everyone again. Marissa, how's Mr. Williams doing?
So I just got off the phone with the nurse manager from Sunrise Home Health. She said she's been checking in with him. He's been doing great with his home health aides, OT, PT. His conditions have been improving. So I think all the recommendations that we made at his discharge planning were pretty great to his continuation of care.
All right. Great work, team.
Nice job.